Will additional ptosis surgery make my subbrow area fuller and bring down the crease on my right eye? I had ptosis surgery combined with Asian eyelid surgery 7 months ago, but my results left me very asymmetrical. The ptosis surgery did not work since the lid level remains the same. I want to try revisional surgery or perhaps something like Restylane filler to try to make my right eye match my left. Will it be possible to achieve more symmetry, and how?
Thank you for your question. You've submitted a question where you describe having had ptosis surgery prior and concern about whether or not additional ptosis surgery would correct some volume that you want to see in the subbrow area as well as lower the eyelid crease. You mentioned in your question that the ptosis surgery didn't work because your eyelid still droops. So let's discuss a little bit about what you're experiencing and whether or not the additional ptosis surgery which you may need would provide the results you're looking for. So understanding what defines the eyelid crease has to do with the position of particular fibers that come from a muscle called the levator muscle. And the levator muscle is the muscle that is like the word elevator, and it just is what brings up your eyelid and is responsible for most of your eyelid function. So in routine, let's say Asian eyelid surgery, where we're not doing anything with the levator muscle, then fixation of the crease can be relatively straightforward and stable. However, when you are doing a procedure such as a ptosis operation, where you are trying to manipulate the levator muscle, then you are dealing with some variability. Now, when ptosis surgery is performed, the surgeon will typically have to open an area called the orbital septum and deal with some fat. Now, some surgeons will resect the fat to allow for access and better definition of the muscle, and other surgeons may just push the fat back, and it just depends on a case-by-case basis and based on the style of the individual surgeon and of course the anatomy they find. So what you're asking is that can the eyelid crease or the subbrow area have better volume, be altered, I should say, where the volume of the subbrow area would be improved as well as the eyelid crease position? Well, I think that since you feel like the ptosis has not been fully corrected, that should, unfortunately, kind of in the hierarchy of issues, probably be the top of the list, where you want to get the eyelid height correct. In terms of the eyelid crease, ptosis surgery very often will result in a lot of swelling at the pretarsal area, the area between the eyelid crease and the eyelashes. And that swelling can linger for months and months and months. It can linger for a year. And it can artificially make the crease look high. The other part of the equation, which is about the subbrow area and the fullness, most likely is more a factor related to the volume of fat that is in that space. So I think the answer to your question is the ptosis correction or revision would hopefully elevate the eyelid to the desired level, shape, contour, and the crease may be situated closer to its ideal location once all the swelling and everything is resolved. But it has been my experience in a situation where there is relative volume deficit that if a patient wants more volume in that area, we would do something called microfat transfer. And microfat transfer basically is taking fat from another part of the body where you do a specific method of liposuction, I should say, or suction-assisted lipectomy, and take that fat and place it into the skin, under the skin of the subbrow skin. Now that's a distinction from the orbit and the skin of the eyelid. So this is a discussion that you should have with your surgeon who performed the Ptosis surgery. So I think that the answer to your question is that really it's about the eyelid height. There may be some effect on the eyelid crease, but I think the significant part of your concern in terms of the volume is it would require some type of fat transfer or some type of volume enhancement procedure. So my recommendation is you meet with your surgeon who performed the initial Ptosis surgery and discuss these concerns. It is usually best to go to the original surgeon when it comes to a specialized procedure such as Ptosis, who knows the anatomy, knows your anatomy, and it will be able to guide you as far as any further surgery necessary. If that for any reason is not to your satisfaction, certainly getting additional opinions is appropriate. So I hope that was helpful. I wish you the best of luck, and thank you for your question.